We got to talk about menopause. And this is with the goal of breaking the stigma and, of course, normalizing this experience that every woman goes through.
And it's not only important for women, but for the men in their lives as well. So let's talk about it. Joining us today to help explain why this is so important and what we need to know is Dr. Claire Edelman with Community Health Network. Thank you so much for being here.
You're so welcome.
It seems like we are hearing more lately about menopause and perimenopause. Why do you think that is?
Menopause is certainly having a moment right now. It's so great. It's so great that women are finally seeking the care that they've deserved all along, and they are getting the care that they deserve.
Because it used to be kind of a taboo subject. Like
Yeah.
you didn't really talk about it. It was just like, oh, the time has come and the time has come.
And that was it.
Yeah, and it just was not discussed. But I feel like maybe because the internet generation is getting older, millennials are well into their 40s now, we're seeing so much more about it. So can you just break down the difference between perimenopause and menopause and roughly like age ranges of when they
Sure.
start?
Menopause is defined as going a whole year without a period, and the average age is 51, 52. And so perimenopause can happen like 10 years before that. So with that normal range, 45 to 55 for menopause, perimenopause can happen as early as 35.
Wow. And what are some of the symptoms to look for?
The most common symptom and well-known symptom is hot flashes and night sweats. A lot of people know about that, but some people don't know about brain fog, mood changes, weight gain, sleep disturbance, and a lot of times my patients talk about just not feeling like themselves.
Yeah, because there's so much focus on childbearing years. And I'm like, all the things you named sounds like pregnancy.
Sure.
It also sounds like a period too. And it's just like the symptoms, unfortunately, they kind of keep going, but you might just be in a different phase of your physical journey as a woman. I think it's important we talk about this. What should men know about this? And you could touch on treatment within that too, but I think it's good that our partners and men understand the changes that women's bodies are still going through.
Sure, I think just being aware of that it will happen, that it's a castration event. If men went through a castration event, we would have the treatment in the water, right? It is, if every woman who is lucky enough to live past the age of 50 will experience it. And so the treatment, as long as benefits outweigh risk, hormone replacement therapy is kind of the gold standard treatment. And that includes systemic hormone therapy with estrogen and progesterone. If you have a uterus, you need progesterone on board, or estrogen alone if you don't have a uterus. And vaginal hormones. Vaginal estrogen is a life-saving medication that is low risk, it is covered by insurance, and is low cost, and everyone should ask about it with their provider.
What's the most important message you want to get across when it comes to this?
I think seeking care early and often. And if your provider doesn't bring it up yourself and learn kind of what to look forward to, I guess.
Yeah, and hopefully on the other end, we'll start seeing more research dedicated to this topic
That is so
too.
important.
Yeah. Okay. Thank you so much
You're
for
so
being
welcome.
here. Our news continues after the break, so don't you move.